Hey everyone, and welcome to today's Explainer. Today, we are exploring a really fundamental shift in how we view our well-being. Look, if you've been feeling, I don't know, just completely burnt out by the state of the world lately, you are absolutely going to want to pay close attention today. We're looking at some truly fascinating research on how shifting our energy away from those massive, overwhelming global crises and instead redirecting it right into our local communities can radically transform our mental and physical health. So let's start with a big question. Why does the pursuit of global health actually make us feel more powerless? It's kind of this modern paradox, right? We have unprecedented access to global information and macro-level health metrics, and yet so many of us are dealing with chronic stress and just sheer exhaustion. The reality is, constantly obsessing over wars in other continents, distant tragedies, and international policy resolutions where you have absolutely no say, it just strips you of your individual autonomy. What truly affects your daily life and your health is related to your locality, your actual neighborhood, and not a crisis thousands of miles away. Section 1. The Global Health Crisis. When macro policies fail the individual. Okay, let's dive into this. For decades, the traditional approach has sort of just assumed that health is managed through these massive globalized clinical systems. You know the type. Hyper-medicalized, scaling up to abstract metrics, where we as citizens basically just become passive consumers. But the local reality tells a completely different story. This top-down disconnect breeds profound systemic vulnerability. Instead of feeling empowered, everyday people end up experiencing stagnating life quality, alienation, and this kind of learned helplessness against these massive global forces. Moving on to Section 2, the Health Capital Model, an economic approach to well-being. To fix this top-down failure, we really have to look at Professor Marcenes' groundbreaking framework. He reconceptualizes health as health capital. Now, this means health isn't just the absence of disease, it's an active cumulative stock of your mental, social, and physical well-being. Think of it exactly like an investment portfolio. Your health capital can appreciate through deliberate investments, or it can rapidly depreciate through neglect and disempowering environments. You literally have the power to grow it based entirely on where you choose to focus. The research put this so starkly. It says, this globalized, technocratic focus acts as a depreciating asset on human well-being, eroding individual autonomy. This is a huge realization. Obsessing over centralized bureaucratic mandates and macro crises literally drains your bank account of mental and social well-being. Why? Because it forces your focus entirely onto problems that are way outside your sphere of influence. And this brilliantly illustrates the two mechanics governing your personal health equation. On one hand, the global focus acts as your depreciation factor. Doom scrolling through distant tragedies diminishes your agency and leads straight to psychological depletion. On the other hand, community involvement is your high-yield investment. By focusing on community issues, where you actually have a tangible say, unlike with global policies, you restore your individual autonomy. Engaging locally builds real resilience and activates the biological power of social cohesion. Section 3. Reclaiming your local autonomy, power and purpose at zero cost. When we are locked into that macro-industrial treadmill we talked about, enjoyment is pretty much just commodified. But true well-being is defined as eudaimonic joy. That's joy derived from meaning, connection, and real community contribution. We are hardwired for tribal, pro-social connection. When you work collectively to solve problems on your own street, you bridge the gap between abstract ideals and lived reality, and that naturally generates this eudaimonic joy. Now, you might be wondering, what massive capital injection is required to fund this shift? Well, zero. The financial cost required to generate this eudaimonic joy and restore your purpose is absolutely zero. Traditional public health usually assumes better outcomes require massive spending, but the health capital framework shatters this, proving the most potent drivers of our well-being are actually non-monetary. To make this a reality at scale, governments need to step back and enable communities through three key policy shifts. First up, decentralize public health. Shift the resources and decision-making directly to local councils. Second, institutionalize pro-social spaces by designing our urban environments specifically for peer support. And third, reframe our metrics. We have to move way beyond just counting mortality rates and start measuring community cohesion and actual health capital accumulation. Section 4, Community-Led Governance in Action. From top-down to bottom-up empowerment. Let's move to and see how this builds from psychological theory into actual structural reality. So why is a community-led structure actually more effective? The research identifies 4 core drivers. First is local context. Central mandates almost always miss unique regional needs. Second is agility. Communities can respond to crises way faster than rigid bureaucracies. Third is trust. Citizens cooperate far more with familiar neighbors than distant, faceless officials. And finally, resource optimization. Local actors know exactly where the gaps are, which slashes wasted spending. Now, what's really interesting about this slide is how tangible this shift is across major sectors. In public health, instead of waiting on massive national lockdowns, communities can utilize localized health tracking. In disaster response, rather than helplessly waiting around for federal aid, neighborhoods train their own emergency teams. And in urban development, residents actually engage in participatory budgeting rather than just adhering to distant state plans. You have a highly impactful say in shaping the environment that directly affects you. Section 5. Challenges of local control. The real-world hurdles of decentralization. To be totally fair and impartial here, shifting power away from centralized structures does come with some complex hurdles, and the source material notes 3 primary challenges to this model. First, funding imbalances. Wealthier communities naturally generate more resources, which risks deepening inequality for poorer areas. Second, capacity limits. Local agencies sometimes just lack the technical expertise or the staff to manage highly complex infrastructure. And third, inconsistent standards. Decentralization can occasionally lead to fragmented regulations and uneven service quality when you cross from one local border to the next. These are just practical realities that have to be managed in any localized system. Which brings us to a final, pretty provocative thought. Where are you choosing to spend your health capital today? The pursuit of macro-level global health often leaves us feeling utterly powerless. But as the data clearly shows, investing your attention into your local community is a high-return strategy that absolutely restores your autonomy. So are you depreciating your mental health on distant doom scrolling, or are you investing it directly into the community right outside your front door? It's a really powerful choice. Thank you so much for joining me for this explainer, and I hope this gives you a completely new perspective on where to focus your energy going forward.